Thank you all for having me here. I'm going to share my journey over the last 20 years. In fact, over the last 10 years, I've transitioned to Epic twice. So this is my third transition to Epic. If you want to hear about the pain, just come. So when I was recruited to Children's Health Ireland, which is a huge privilege, I looked carefully at the mission. What are we supposed to do? And what we are supposed to do is to promote and provide child and family-centered healthcare that is research-informed. And the electronic health record plays an important role in this step forward. I think we have to be really, really mindful that we are living in an unbelievable environment. It's not only the hospitals, the local healthcare, the GPs and family practices, but we also have the backbone of the universities, and I think it's unbelievably untapped a resource, and Children's Health Ireland is currently partnering with these 4 universities. But Children's Health Ireland is not everything that provides child health care and support. We've built a beautiful national partnership that not only includes the Republic, but also our partners in Northern Ireland. And I would encourage you to think about health across the age spectrum, because many of the diseases that you're dealing with in the adult world have their roots in childhood or in early childhood. And I'm absolutely grateful to the partnership that what we have with our adult colleagues. So as Neil was saying, in these 10 or 11 steps, how many painful steps was it? We're building a digital hospital, right? So this is basically absorbing us from morning to nighttime. We don't get a pen or a paper. When we eventually make it into the new children's hospital, we're going to be digital. In this hospital, I'm not sure if you had the privilege of seeing it more recently, absolutely spectacular, there's this little tiny thing on the 3rd floor, which is called the Pediatric Academic Health Sciences Center. And that is supposed to be, this is supposed to be the engine of care transformation or research or education. And one of those components is big data for small people. We have to make sure that the data that we're capturing in our healthcare system, in our labs, in all of the studies and research we're doing are going to be impactful for children and families. So how the heck are we going to do this? So I have to disclose to you that the only electronic health record experience that I have is coming from multiple different ones is into Epic. I'm not saying that's the only record we should be looking at. There are many, many out there. So transitioning at SickKids, which was a transition in an ivory tower, but transitioning in Alberta was a transition across the entire province. So each of those experiences is quite unique. But I also need you to know that an electronic health record such as Epic is not one database. In fact, Epic is 3 databases, and they have the fancy names of Chronicles, Clarities, and Caboodle. Okay, so I'm going to share a little bit of this with you. I think when we think about having an electronic system around us, or a digital record, or a digital hospital, digital healthcare systems, there are lots of things that come to mind that we can do a whole lot better. Administrative processes, clearly. We can have process-led research. Remember, everybody wants to know what are the wait times, how many people are we seeing in window. We can operationally benchmark and report, which is really important for the health authorities. But then there's also pre-established queries. Queries are asked to data, and in Epic that's called slice and dice. What's really important and probably underestimated is how much information we're capturing in electronic health record about the population we serve. One point that Margot made earlier on, which is absolutely critical, is that electronic health records are there to open the doors for patients and families to be part of research, and there's a right of families to be part of research. Accessing many of the medications that I prescribe, such as biologic medications, for example, are only accessible in the context of research. So patients have the right to be part of it and have the right to opt out if they decide not to. It's easy to imagine that when you start entering data into a health record, that you have observational cohorts. I will have a cohort of children with arthritis all across the island, all across the available healthcare systems. I can tell how many patients are diagnosed, what is their treatment, and what other interventions will they get. The health records have clinical trial software, which is really, really important because it sets a standard for international companies to make us attractive here as a place to do trials. There's a really important component of quality and safety that we have to embark on, and we have to do it well, because that's something we need to proactively approach, and many rare events are captured. But think about it slightly outside of the system. So, we're always blamed to ask two rheumatologists get 4 opinions, but the reality is that all the communities, including ours in rheumatology, over the last decades have made tremendous efforts of streamlining our care, of developing best practice, of having recommendations and guidelines. How often are they actually put into practice? That is a question you can ask to digital systems. Are we adhering with treat-to-target strategies? Are we adhering with screening strategies? And how can we do better? So clearly a learning for everybody at the bedside, the entire team. We talked about integrated machine learning algorithms and decision support systems that can be implemented. What I think is really important to focus on is health resource utilization. What are we doing in the hospital? What should we be doing? What should we be doing in community practice? What is the value for money? So we have to think about what kind of data do we need to capture in order to be able to answer the question, what is the value for money? So I'm going to share one deep dive with you. So I talked about having worked in Ontario and in Alberta, and I'm going to focus on the Ontario experience. This is work of the group of researchers working at SickKids Hospital trying to get access to clinical data. So you can easily see that they're all wonderfully captured, but can you use them for research? Can you pull them out? Can you merge them with lab data on genetics, genomics? Can you utilize them to learn? So as I told you, the electronic health records are more than one database. They have a very complex data structure. I'm going to show you that. And queries are extremely difficult. And the other thing is restricted access. We talked about GDPR, but it's not only GDPR, it's actually a whole lot more complicated than that. The vast majority of institutions have built a parallel structure to receive data in a safe and secure way. And typically, structures like REDCap or others are used for this. And I think we will need to embark on this, and I'm nagging Niall 24/7 about it. But the key thing is to enable the utilization of data captured in the electronic records to create meaningful result, and that is done through what's called a transformational schema approach. So I introduced you to the 3 components of EPIC. Clarity is the one that has relational tables. It has actually 18,000 relational tables in it. So you can start querying 18,000 relational tables, entirely impossible. So what we're doing is we're basically downloading every night the entire EPIC record at the Children's Hospital. We're putting them through a schema of reducing relational tables into a meaningful, almost linear path, which is this scheme of filtering and then the scheme of optimizing. And at the end of the day, you have a database that looks a bit like this, where you have patient data, clinical data, lab data. This process was an 18-month project, and it's published. You have the reference down there. And the good thing is that we as a community are sharing. So as soon as we're rolling out our electronic health records, I would strongly suggest we utilize the scheme. We're looking at, does it work for us, as we can do across the country. So this opportunity, I'm not saying that's the only one, I'm just giving you a little bit of a glimpse, is an opportunity to utilize health records to copying data into a secure cloud and then create sequential schemas with the aim of care transformation. There's also very effective data validation incorporated in it. So what we want to do is facilitate similar work in all other organizations, and expand and incorporate other data sources to create a linkable repository, including real-time data, imaging, genetics, and much more. I believe we have a unique opportunity here in Ireland. We have well-trained, passionate, innovative, interdisciplinary health teams, and many of them have spoken here today. We have a commitment to patient and family-centered care and to co-design of care. We have to make this happen. It cannot just be a phrase. And we have, in a very short time, 10 years is basically no time, a leading healthcare system, or more than one, across our country. So we are building on it, and it's going to completely transform what we're doing. We have a unique academic partnership, and I want us to incorporate this academic partnership. These are the brilliant minds that can do systems biology and all of those fancy different things. They need to be at our table, and we need to partner. And I believe that in a matter of 10 years, we can build a first in Europe transformational care, education, and research ecosystem. For me, there is no divide between research and care. We as researchers make care better, make outcomes better. I believe research is care, and care is research, and I want to thank you for your attention.